NEUROANATOMY Part A Development of Skull. Intramembranous ossification occurs in skull bones. Gaps between developing bones known as fontanellae. Fontanellae are covered by fibrous membrane. Anterior fontanellae. It is located between frontal bone anteriorly and the parietal bone posteriorly. It is the last to disappear. It disappears at the age of 18 to 24 months after birth. After fusion, bregma suture is formed. Posterior fontanellae. It is located between the parietal bone anteriorly and the occipital bone posteriorly. It is the first fontanellae to disappear. It disappears at the age of 2 to 3 months after birth. After fusion, lambda suture is formed. Posterior fontanellae. It is also known as the mastoid fontanellae. It is located between the parietal bone superiorly, occipital bone posteriorly, and temporal bone anteriorly. It is the third fontanellae to disappear. It disappears by the age of 6 to 18 months after birth, average around 12 months. After fusion, asterion suture is formed. Anterior fontanellae. It is also known as sphenoidal fontanellae. It is located between the frontal bone anteriorly, parietal bone posterior-superiorly, temporal bone posterior-inferiorly, and greater wing of sphenoid inferiorly. It is the second fontanellae to disappear. It disappears about 6 months after birth. After fusion, Tyrian suture is formed. Important information. If the baby is dehydrated, the fontanellae is depressed as compared with that of a normal baby. If the fontanellae is raised, this could be a clinical case of raised intracranial tension. If a CSF sample is to be taken in a baby, the anterior fontanellae can be used to aspirate the CSF. The needle pierces the fibrous membrane of fontanellae and the dura mater and arachnoid mater to enter the subarachnoid space from where CSF sample can be aspirated. Tyrion is a H-shaped suture formed after ossification of anterolateral fontanellae. Relations of Tyrion: anteriorly frontal bone, posterior superiorly parietal bone, posterior inferiorly temporal bone, inferiorly greater wing of sphenoid bone. Tyrion is the weakest point of the skull. Deep to the tyrion, there is anterior branch of the middle meningeal artery. In case of fracture of tyrion, this anterior branch of middle meningeal artery may get injured and bleed, leading to extradural or epidural hemorrhage. Important information. Maxillary artery is a branch of external carotid artery. Middle meningeal artery is a branch of first part of maxillary artery. It divides into anterior and a posterior branch. The anterior branch of middle meningeal artery lies deep to the tyrion. Middle meningeal artery enters the skull in the middle cranial fossa through the foramen spinosum. On CT scan, you can find an ominous sign, biconvex shadow. It is an extradural or epidural bleed. It occurs outside the dura mater. It occurs due to collection of blood due to bleeding from anterior division of middle meningeal artery deep to the tyrion. Patients with extradural hemorrhage, loss of consciousness immediately after bleed, might gain consciousness, lucid interval, once again have loss of consciousness, and we might lose the patient. Important information. Lucid interval is characteristic feature of patient having an extradural hemorrhage. Tyrion is also lying over another part of structure, sylvian point. Sylvian point is the beginning of stem of lateral sulcus of the brain.